I'd now like to call Ed Crabtree, owner of Crabtree Patent and Trademark, to introduce today's speaker.
Thank you, Pam. A few months ago, my son Mark mentioned to me, and Mark in the past has been in the medical supply business, you've got to meet this special doctor. He takes teams of doctors and nurses to third world countries to tackle not only children with cleft palates, but these horrific facial deformity. On your table are a few brochures showing pictures of some of these children. In 1993, Face the Challenge was founded by Dr. Robinson and his wife, Ginger, who's a critical care nurse. Ever since they married in 1981, Randy and Ginger have shared a vision to offer their medical skills to the world's needy. A quote from the brochure. Wherever God leads and allows, we aim to take the edge off of suffering and give real hope through corrective surgeries. I would urge that Dr. Robinson epitomizes what Rotary is all about, service above self. Please welcome Dr. Randy Robinson.
Thank you. It's a pleasure to be here, Ed. We've really enjoyed getting to know you. And my father was a Rotarian, so I would join him many times in the Kansas City Club downtown. And occasionally I get the opportunity to speak to different service clubs. And it's been a number of years since I've spoken to Rotary, but I spoke to the Rotary Club in Castle Rock, and they wrote me a thank you letter, and I just want to read that to you here. It says, Dear Dr. Robinson, the Rotary Club of Castle Rock has decided to send you this note of thanks by a vote of 14 to 13. I hope the majority of you enjoy this as well. For 21 years, the Face the Challenge teams have been performing surgery on deformed children and adults in developing countries around the world in order to show the love of Christ. And it's my pleasure to share with you what we do and what we're about, hopefully to inspire you to do some of the same things in the area where you work and where you have a specialization. The face is so important. This is my daughter Anna at age 3. And with that smile, she could pretty much work me however she wants. And her brothers would know it. They would warn me, watch out, Dad, she's just trying to get out from eating her vegetables. This face is so important in communication. It not only is how people respond to us, but how we respond to other people, and that how we feel about our face, how we look, who we are. It becomes such an important part of our identity. And so now not only Anna at 25 now is working in Uganda, her smile. Now I have my granddaughter Emily, also known as Silly Upside Down Girl, with her smile. And you all know this. You know this about yourself. You know this about your children and your grandchildren. The face is so important. But there are some people who do not have the right facial proportions. And some of it can be pretty subtle. Some of it can be pretty profound. This girl was 16 when she came to see me, and she had been at the orthodontist. He had straightened her teeth, but when she smiled, all you could see would be gum tissue. Dr. Metcalf is here, so he knows what I'm talking about. She could eat corn on the cob from across the street. Her jaw was back. She's very shy, wouldn't look me in the eye as we try and talk to her at her appointments. So we did about a 5-hour to 6-hour surgery for her, and I moved her top jaw up so it improved her smile line, advanced her lower jaw to bring her chin forward, and then here she is afterwards. Now she has her braces off. She comes into the office, and she looks good. She knows she looks good. And she knows I know she looks good. And it's a little uncomfortable, It's like, wow. And there's nothing more wonderful to see someone who feels good about themselves walk into the room and just light it up, and that's what happened with her. Sadly, there are children and adults with even more severe deformities. There are all varieties of cleft lip and palates, and some from very severe craniofacial clefts that were described by the person I trained with in Paris, France, Paul Tessier. And some of them can extend all the way up through the eye here, as you see a bilateral Tessier number 4 cleft. This little girl was regarded as a monster in her village in Vietnam, and everyone would run away from her. Sometimes the deformity is not only related to clefting, but can be related to tumors. As you see in this gentleman with a large facial tumor here that's growing and causing a facial deformity. The surgery for that is a radical resection. This girl has a severe deformity called Romberg's hemifacial atrophy, where the face actually starts regressing and the fat thins out and the bone shrinks away. And this, of course, is a patient with a burn in China. But the thing that's amazing to me is that even with the children with some of the most grotesque-looking faces, monstrous, there seems to be a parent there many times who just loves that child and will do anything for that child. Unfortunately, in some cultures, a facial deformity is seen as a curse. The family's done something to have the child deserve this. I treated one girl from Malaysia, and it was said that the kitchen god had cursed her at birth. When a face is repaired, it changes a life, it changes a family, and allows them to enter back into society and get educated, to get work. Many of them who can't end up in orphanages or begging on the streets. So it's serious. It's a big deal. Now, I have to tell you, when I finished my training in France, I came back and I did another year of general surgery here at St. Joseph Hospital, and I've been practicing here since 1992. I have a medical degree and a dental degree and 12 years of training, and my wife says I'm highly qualified to be utterly useless. But we have come together on this, and when I came back, I was asked by a friend of mine to go on a trip to Costa Rica. It was sponsored by Rotary International. So if you will, the seed was planted long ago, but it was watered and nourished by Rotary with this trip. And there were 4 surgeons who went on the trip, no anesthesiologist, and the sponsoring surgeon forgot to bring all the instruments except for one set. So we spent the 5 days watching each other operate. And after that trip, I flew to Panama for an overnight flight to Bolivia. A craniofacial friend of mine from Belgium had asked me to join him in Bolivia. It was my first year in practice. I didn't have any money and I didn't have any patients, so sure, I had the time. Let's go. And so I headed on down to Bolivia. It took 2 days to reach Sucre, Bolivia, in the middle of the Andes Mountains. And there, the anesthesia was a glass jar with some fluid in it that bubbled, gas from a brown tank that they covered back here with a drape. And it was quite primitive. And some of the surgeries we were doing were pretty advanced. And I had broken the jaw on one girl with a deformity, and I was going to reset it, but we ran out of wire. So we usually dovetail with the local missionary, so I sent the local missionary to get some wire. I said, I don't care what you bring, I just need some wire so I can wire the teeth together. He showed up with chicken wire. Yeah, really. So I unwound the chicken wire, and we ran it through the autoclave. It had blackened because of the galvanization of it, and wired the teeth together and got through the surgery. And I thought, okay, no instruments on one trip, chicken wire on the other trip. I wonder if I can do this better. So about 6 months later, I returned to Bolivia. It was my second trip. And a good friend of mine, Jim Ringenberg, we had met at Lost Valley Ranch and at the Christian Businessmen's Committee. And he came up and gave me a check for $1,000. And I said, no, I can't take that because Ginger and I do this ourselves. And he says, you don't understand. If you take this, then it's like I'm holding the scalpel with you. And I said, okay, maybe I'm starting to get the idea here. So with his help, we returned to Bolivia with wonderful supplies and were able to complete that mission. Ginger would have me make sure that I tell you the numbers, and these are, I would love to sit and talk about the children all day, but this is important. I think that we were formed in 1993 with the help of Jim Ringenberg, and as a 501c3, we've taken care of just over 1,200 patients, some with cleft lip and palate, some with major deformities. We've had 171 different healthcare professionals and team members go with us. We usually take the surgeons and the anesthesiologists, we make them pay for their trip. The nurses and scrub techs, we scholarship, and then of course any supplies. And usually we have one or two team liaison people who go with us. They're non-medical. They have to help the nurses carry the bags. I'm teasing, the doctors carry the bags. And but we have had wonderful team participation from doctors and nurses and people from all over the country. We've made 35 missions, Costa Rica, Bolivia, Vietnam, China, Moldova, Siberia, Ukraine. We've had children from places of all over the world, and you can see them there, Malaysia, Mongolia, Kenya, Kyrgyzstan, I forgot to put up here, the Philippines, and even Pennsylvania. And occasionally we get the opportunity to help some of the battered women here in Colorado. We've helped organize 2 other spin-off missions groups, one into Bolivia and then one into Vietnam. I think this number is actually closer to 1 million, but it's certainly over $500,000 of surgical equipment and supplies. We get a lot of donations that we're able to take with us. And we've sponsored surgeons coming to the United States for training. We've written textbooks for them and translated them into Vietnamese. And we've probably trained over 100 surgeons with our lectures and demonstration surgeries. What's interesting, that last item, the training, I never anticipated. As we started this, it was like, okay, we're going to help these kids. But what I found is by going to Vietnam, this will be my 21st year in Vietnam, we leave in 2 weeks, I've been able to train a couple of generations of their surgeons over the years. And it's phenomenal now that the baby doc surgeons who were just finishing their training and starting to watch surgeries are now the heads of the departments. And it's been a wonderful thing to see. And pretty much I'm working myself out of a job there in Vietnam. So when we go, we have lectures. There's usually simultaneous translations that go on. We have case presentations and review the patients together. We bring them textbooks. And, of course, the surgeries, we always operate with them. And a lot of teams, and there are a number of them around the country who go overseas, and typically when they go, they'll take the whole team, they'll take over the hospital, and they'll do many, many patients in that particular, usually cleft lip and palate. Usually they take over the hospital, and they don't interact as much with the local doctors. I think we have become a little unique in our calling with Face the Challenge. We really try to adhere that name. So we try and find the poorest, the most deformed, and the ones that the other teams won't take. And so we find that they save up the patients for us. Afterwards, we give them certificates. And after I'd been going to Vietnam 10 years, they had a ceremony. They flew some people down from Hanoi. I usually operate in Ho Chi Minh City, Saigon. And they had a ceremony with some of the dignitaries, and I stood up, and they gave me a certificate and a small red card with Ho Chi Minh on it, Uncle Ho. And they said, you keep this card, you'll never have problem in Vietnam. And I think I'm a member of the Communist Party in Vietnam, but I don't know. I have not had to use the card. Our screening. When we screen the first day we arrive, typically we'll screen 50 to 100 patients in an afternoon or all day, depending on the complexity. Again, this is a wonderful teaching time. Sadly, there's a group of patients that we're not able to treat. Ones that either we don't have a neurosurgeon, or we didn't bring the right equipment, or they do not have enough complexity in their ICU for us to allow us to take care of this particular patient. So those are the ones that get turned away, and that's always hard because many of them travel a long ways to come and see, hoping that the Americans can do something for their child. And the look on the parents' faces it means so much because of that hope, and that maybe someone can take care of them. We take care of a lot of orphans too. So a select group, we try and make sure we do 1 or 2 days of children from the orphanages. Many of the children who have facial deformities are moved to the orphanages because they're not wanted. And this little fellow we named Spike, he was an orphan in China. And so when we were in China, most of the patients we took care of were orphans. And like I said, we have patients, things you only see in the textbooks that are bizarre. I just put this one here because the father was so affectionate for his daughter. She has a very, very rare, there are only a few cases published in the world, called facial duplication. And she started to form a second upper jaw. She has 2 lower jaws that are telescoped sideways on each other. And but still, happy-go-lucky. She doesn't know yet what a facial deformity means, and we were able to reconstruct her at one of the early stages. We take lots and lots of equipment. Usually we're able to get the bags fees waived by United. They've helped us a lot over the years. So if any of you have a United Airlines connection, thank you. We also bring children here to the United States. And I want to tell you about 4 or 5 children here that I have the time remaining that have affected me. And this was Johnny. I met Johnny my first trip to Bolivia, and he had this kind of growth you see coming down on his face. And his mother would put a Band-Aid over it and not take him out because she always had it covered. It developed a little bit of an ulcer. And Johnny had what was called an encephalocele. It's an outgrowth of the brain that comes down through an opening in the forehead between the eyes. So his eyes were twice as wide apart as they should be. And it's just like, oh, he's got an infection, he's odd looking. But the mother was very ashamed of it. And of course, we needed a neurosurgeon, so I couldn't do his surgery in Bolivia. But we brought him and another little girl who had a similar problem, and another little girl with a cleft. 3 children from Bolivia. And wonderfully, St. Joseph Hospital helped us, and we were able to operate on those 3 children here. But the thing with Johnny was that he just had this huge deformity of this excess brain tissue growing down. Of course, when we took his forehead off and removed that brain tissue, everybody asked, well, does that affect his thinking, his intellect? And the answer was not that he's going to know of. So, but Johnny did great following the surgery. And here you can see we've moved his eyes back together and given him a new nose. And now he doesn't have to wear a Band-Aid. Feng. Feng was a girl. She has a form of giant cell granulomas. It's also similar to, she looks like she has a phenomenon called cherubism, where the jaw grows excessively, and that causes it to displace. All the other teams had passed her up, and we decided to remove her entire lower jaw. You can see it's filled with tumor here. And so we took off her entire lower jaw, and she got 2 rib grafts to replace the joints. I took out all the bloody slides, by the way, so for those of you with temperaments that didn't want to see that. And here she is afterwards. So now she's able to wear a denture and get a job. Joel lived in a mud hut in Africa. And Joel was no longer allowed to go to school because he scared the other children. A missionary there in Africa, near Kajabi, contacted us as Joel's face downloaded on the computer. My wife just went, we have to help him. And I thought, right, honey, so how are we going to do this? She goes, I'm going to call Terrell Davis's mother. So lo and behold, Cateri Davis got hold of Terrell, and Terrell helped get Joel here. And we did his surgery, 18 hours. Took a bone from his leg and reconstructed his jaw. Now, I remember I told you about the girl who came in and flirted with me. Okay, so we created a monster in Joel because we had a party. And there's a large group of Kenyans and Ugandans here in Denver, if you don't know. But we had a party, and I can't remember the word for it, but Joel latched onto these two young ladies, and it was really fun to see because he felt good about himself. He's now a pastor in Kenya. Changed our family. He lived with us for 6 weeks. It was one of the most amazing experiences. I had to teach him how to use a toilet. And Pam, is this clock correct up here? Okay. And then I want to tell you about T. T was a little girl who was burned in a cooking fire in Vietnam. It was in our first trip in 1995 when I took a team. We were using old Army anesthesia equipment, operating room table, and the operating room light was a Skytron operating light that the U.S. Army had put on. It's a fancy operating light, but there were no light bulbs except for a 60-watt bulb, and that's all the Vietnamese had to put in. And the anesthesia machine leaked as much gas as we were giving the patient, and I don't remember her surgery very much. But her chin was so scarred down she couldn't lift her head, and her eyes were pulled down like this. And she couldn't eat because her lip was adhered to her chest. So we had to put her to sleep, and then I cut through the scar as fast as I could so we could get her chin up and get the breathing tube in, and then proceeded to skin graft and lift her eyes up and lift her mouth back up. I regret I don't have a picture after the bandages were moved because they came off after we left. But this is T and her mother. So I didn't get rid of all the scarring, but at least she can hold her head up now. Our team in China, I've gone twice, one in 97. In 97 we saw this girl who was about 10 at the time. She had come from Mongolia, Inner Mongolia, so she had come to see us in Shenyang, China, which is in northeast China. They had traveled by bus, ox cart, and train. Not in that order, of course. Ox cart, bus, and train. And as we got to a point where we were screening, she had a fever. Fever, we can't operate. So she got bumped from the schedule. 97, didn't do her surgery. We come back in 2000, bring another team, and there's Fing. Fing is a Chinese albino. She has a complete cleft lip and complete palate. She's mentally retarded. The second time she was brought by her grandmother. And so we put her on the schedule. It got to be the last day. She was the last patient of the last day, and the Chinese were having a banquet for us. So we said, okay, well, let's cancel the last patient, and we won't do her surgery. The Chinese will have to do her surgery. And the nurse came in and said, no, you don't understand. She was bumped 3 years ago, and the father told the grandmother, if the Americans don't do her surgery, leave her at the train station in Shenyang. Don't bring her home. I said, forget the banquet. And we did her surgery. And so you think about the face. Yes, the face, we smile, we talk, we interact. And it becomes so important in those relationships. And sometimes truly life or death. I mentioned Jim Ringenberg. Jim Ringenberg has worked with English Language Institute in China. And when he was there, he went with us in 97, he met Wen Rong. Wen Rong was an orphan in China, and she was just as cute as a button, and he met her, and she didn't have a right ear. And he said, when you come, can you fix her right ear? And I said, well, sure, of course we'll fix her right ear. And so the operation involves taking cartilage from the rib. Here's her normal ear, and here's her right ear. And you can see she has microtia, is what it's called. And so we outline the position and the angulation, and then make a little template, and then take a rib graft and carve it and form an ear, and then plant it and suction the skin down like a vacuum-formed plastic mold, and then that's the first stage of the ear reconstruction. But Jim couldn't get Wen Rong out of his mind. He came back and he said, I'm going to adopt her. It took him almost 5 years to adopt her. Her uncle, once he realized there was an American wanting to adopt the girl from the orphanage, because once they reach age of maturity, they are sold many times into the prostitution trade. And she actually disappeared from the orphanage. They didn't know where she was for a while. And through some political contacts that Jim had, he was able to get her, adopt her, and bring her back to Fort Collins with her new 4 brothers. And this is how you always want a girl. This is how you get one, okay? And now she's Jenna. And Jenna is amazing. Jenna's a teacher out in Highlands Ranch now. And this is a story of redemption. And I never thought facial surgery was a story of redemption, but indeed it is. And so I just want to say thanks to Ginger, who makes it all possible. Without my wife, none of this would happen. She's actually amazing. I'm sorry she couldn't be here today. And so there's our organization, facethechallenge.org. And I just want to say, take your dreams, dust them off, and get them going. Thank you very much.
We have time for a couple questions. Yes.
Thank you.
We have time for a couple questions. Craig, could you start off?
Doc, a fantastic presentation. God bless you for what you do.
Thank you.
So obviously you're working with a lot of disfigured kids. It's a social stigma. The first girl you showed us couldn't look you in the eye, couldn't engage you at all. So when you travel, how much social stigma is attached where you're going to look for these kids? Now, in some cases, they're finding you, but in other cases, maybe some of the really bad ones, they don't because of that social aspect. Can you talk about that?
Right. So we don't find the children, they find us. So usually in Vietnam, they'll put the word out that the Face the Challenge team is coming, and we work when they're in Saigon. We work with their 3 main hospitals: their university hospital, their national hospital, and their city hospital. So through those 3 different levels, their districts, they all refer into these tertiary hospitals. So we never have a shortage of patients, but their social elements are stories that sometimes are hard for us to get, but they're all there. So does that?
I have a voice, as you heard earlier.
You have
okay.
a great voice.
So I'm just wondering. I know you showed us a lot of different types of disformities and things that will go on. Are most of them genetic, or are there contributing factors in their environment? Or could you talk a little bit about that?
Great question. And usually I get the Agent Orange question, so maybe that's close. The answer is we'll use the term multifactorial. So there are a lot of different things that can cause clefting. Nutritional issues, about 40% of clefting can be congenital. It's genetic in some syndromes. Others, we don't know why they occur. But there are certain loci on certain genes now, chromosome 6, that are becoming apparent in terms of facial development. And so that's getting better and better. The thing that you see us change the children. I have patients that become cheerleaders and moms and attorneys and musicians and you know, these kids have normal lives and they grow up into adults that are productive and wonderful people. And when a child grows up with a deformity, they develop a character many times of being more resolute, stronger. You know, they've been teased, and for those of us who've been teased, we kind of know what that's like if you can get through it. So it's a big deal.
Yeah. I have you made my eyes puddle up a few times with that. But I was just wondering, is it more elsewhere? I mean, what's it like in this country compared to where you're going?
Right. So the incident, for example, of clefting in the United States is 1 out of 800 to 1 out of 1,000 births. In Asia, it's about 1 out of 400 births. So we think there may be a nutritional side related to folic acid, or there may be a genetic side. We're not sure. Or maybe it's environmental. So clearly some of the agents may have some effect on the genetics for multiple generations, and that's what we're finding, even among our own men and women who served. So.
Hi there. I just wanted to say thank you. It was deeply emotional for me because I have a cleft lip and palate, and it is never lost on me that I was born in a country that could take care of me, with doctors that could take care of me. Just never lost on me. And many of the things that you saw there, I've had upwards of 12 and 15 surgeries. I've had an ear graft and a hip graft that have both helped form a palate and a nose and teeth for me. And it's just remarkable. And every time I see stories or just meet children that face the same things I would have faced in a different country, I realize just how grateful I am to have been born here, how thankful I am for my parents, and for men and women like you that travel and do this work for people. So thank you.
Wow, you're beautiful.
Thank you.
One more, please.
Thanks so very much for what you do. How are you funded?
We have donations. Our average donation is around $100, Ginger would tell you. And so most of it are small donors. Our budget is about $100,000 a year. No one gets paid. We only raise enough to sponsor our trips, and when we have extra equipment needs, we'll try and raise a little bit more money. But we're a fairly small operation, and we run it out of our home. Our basement looks like a supply warehouse now as we're headed to Vietnam. So but it's, you know, every bit helps, and we put it to great use. There's a lot of needs. Wonderful. Thank you for having me.
Yet. I want to present a couple things to Dr. Robinson. Do that first. First, Branch Rickey Baseball. That's in honor of a humanitarian in baseball that we celebrate each year.
I went to the event.
Oh, great.
They had me go to the event.
Oh, nice. Excellent.
Yeah, thank you.
I've also got a card here. And in grateful appreciation for your presentation today, the Rotary Club of Denver has made a donation to the Rotary International Polio Plus Fund, an amount which will inoculate 50 children from polio. And with the Bill and Melinda Gates Foundation's generous 2-to-1 match, this will benefit 150 children worldwide. So thank you.
Wonderful. Thank you. Thank you, guys.
Yes, and last but not least, I'll echo, that was an amazing presentation. We don't give standing ovations lightly here, so it's much appreciated.